Okay, Dr. Brodwin, so you do something here called decompression therapy. Now this will help people that experience sciatica and other issues. So first, again, tell us who would benefit from this type of treatment.
Right, so anybody that has sciatica, as Marlena said, pain down your hip, numbness or tingling in your leg, common classic chiropractic treatment, usually an indication that you have a pinched nerve or a disc problem, and then we go ahead and combine chiropractic and therapy with decompression therapy, which you can see here as the bones compress, whether it's because of age or mileage or work, it bulges and it touches the nerves here, and that's what causes you the pain. So the typical protocol would be take medication, but that's not going to change the physiology or the actual shape of the bones or the disc or the position of it, or surgery, and we want to try to avoid that. So when we do the decompression, as we showed before, what it does is it opens this space up and relieves the pressure by allowing more space for the disc to come back into its normal position like that, and it promotes healing, and you get relief and correction, not just pain relief.
So if someone is experiencing sciatica, what are some of the symptoms that they think maybe they should then come in and...
Anytime you have back pain, number one, you should go to somebody. But once it starts radiating, even if it's numbness or burning, if it radiates into your hip or your fanny or down your leg, those are classic signs of sciatica. Many times people will say, well, I don't have pain, but I have numbness. But numbness is just as severe because it can turn into pain.
And like you said, some of the alternatives I've heard, epidural or surgery, and this is just, again, a way more natural way to go
Well,
about
we have an 87% success ratio with it. So you have pretty good odds of getting better if you follow through and comply. But what are the odds of a successful surgery? You could either have a great one, or you could have issues. And if you have issues, then you're stuck with that. So we just want to try conservative stuff first. Makes more sense.
Great. So before we show decompression therapy, what else can you add about this? How many times do people come in and do this if they see this and are interested?
So with decompression therapy, it is trying to make a change. It is trying to fix things. So it's not a one and done kind of thing. It's not like getting an epidural and then you're done for 6 months till you need the next one. You will come in 20 or 30 times over 2, 3, 4 months. And if you need more, you need more. If you need less, you need less. But it's about making the actual change, not just making that person feel good for a month or 2.
Okay, so if anyone has any questions, where can they reach you?
Absolutely, you can check us out, drjbrodwin.com. We've been here for a long time, or call us at 706-563-3370.
Perfect. Now we'll go show you that decompression therapy and how it works.
Okay, so this is lumbar decompression. Decompression is the opposite of compression. So decompression is where we're trying to relieve the pressure on the disc in your lower back. So people come in, they have a bulging disc or herniated disc, a protruding disc, some people call it a slip disc. And that disc actually bulges out and touches things that it's not supposed to touch. So this is decompression, and what it does is it's a form of 21st century traction, and based on the level of the disc, meaning in the lower back, L1, 2, 3, 4, 5, we set the height of the table so that it can target a specific disc. Now I have an L4 injury from CrossFit and from tennis and from 38 years of adjusting people, so periodically I get on this for maintenance, and what it does is we set the table and we set the amount of pull, and as you can see now by looking at this space, it's starting to open and pull, and what it'll do is for a certain amount of seconds, for 45 seconds, it'll pull at 1 poundage of pull, and then it'll pull a little bit more, and then a little bit more, and a little bit more, and then it will relax. So it's kind of like pumping a sponge underwater. When you squeeze a sponge underwater and you let go, it sucks in the water and absorbs that. That's what this is doing. We're trying to suck the disc back into its normal disc space, away from the nerves and the spinal cord, which is causing the person pain and problems. And as you can see, it's out in the open, so it doesn't hurt. And it's an alternative to having nerve ablations, epidurals, and surgery. So one would think, well, why not try something like this conservatively first prior to surgery? Because if this doesn't work, you can still have surgery, but if surgery doesn't work, you're stuck with that. And people will go on this maybe 15, 20, 30 times over several months because it's not a relief thing where it's trying to give you relief for the weekend. It's actually trying to correct. And you can see now it's pulling me pretty hard. So it pulls, and then we change the amount of pull, and we can change the time and the level of the disc in order to get that person better. And then sometimes we'll combine it with chiropractic care, therapy, and exercise, and even medication if necessary.